Hello and welcome to this episode of TheSquare. My name is Poonam Schallenberger and I'm here with Shane Williams, Design Director and Vice President in our healthcare practice.
Yes.
Welcome to TheSquare, Shane.
Thank you.
So tell me a little bit about what you do as a design director for the practice.
So as a design director, I oversee all of our healthcare projects in some form or fashion, whether that's just a quick review of progress or if it's more hands-on on our larger projects. So really, I kind of get to touch everything we do from a healthcare perspective, both here in Dallas and nationally.
So Shane, when you're looking at these projects, what are you looking for?
So really my role is to ensure that all of our projects are addressing the 5 pillars that we have at Corgan and elevating our design standards. So especially in healthcare, everything is patient experience focused, staff experience focused. And so we look for those moments, either whether it's staff respite areas, whether it's the warmth of the approach of the building, the way it's sited on the site, orientation, energy efficiency, all of those things go into sort of a mental checklist of every project that we do, whether it's an interior renovation or a full exterior ground up facility.
So more than just a place that's beautiful and pretty to look at, but something that actually, one, is functional.
It's functional.
And kind of responds to our needs as humans and patients.
It responds to us as humans. It also addresses the needs of the client. Obviously, they're coming to us with a situation or a project that they need a thoughtful solution for, and so it's really how can we better the environment that it's in.
When we're talking about thoughtful solutions and human-centric design, we have to look at what's trending in national headlines. And thankfully, there's been this overdue but welcome attention and refocus on mental health and well-being and behavioral health. How have you seen that play out in the healthcare practice?
So we see a lot of focus obviously on behavioral health. There's a lot of interest in behavioral health facilities, and that behavioral health facilities really sort of is obviously a facility, but it responds to needs for mental health. As you noticed, there's a lot of conversation right now around mental health, both from a societal perspective, from activities that have happened, but also coming out of the pandemic. A lot of people realized that while during the pandemic there was a lot of connectivity improvements, there was also a lot of isolation, a lot of loneliness, and so a lot of mental health issues really sort of became forefront. And in addition, it's been a national focus from a discussion topic, and so healthcare facilities have started to look at it as a potential service line that doesn't really fit within their acute care environment, but is really sort of its own environment.
Yeah, you saw this huge sort of acceptance in ways that we hadn't before on everything from anxiety and depression and loneliness to, eating disorders and bullying. I think and then like you mentioned, that virtual component allowed us to address topics that were maybe a little bit more taboo to talk about,
right.
But we were able to do it in this private, confidential sort of way.
I think a lot of the celebrities, sports figures, celebrities have started being more open and honest about their mental health concerns, and that has sort of allowed the stigmatism to sort of reduce. I wouldn't say it's gone away, but sort of moving the conversation into a more typical conversation instead of I'm afraid to say this because it's a mental health issue.
Right, and it's not that there was an uptick in these things because of the pandemic. I think it was sort of just shining a light on it in ways that we hadn't before. But I would imagine that it would equal some sort of response from insurance companies and payment models as well, right?
There has been a shift in reimbursement models to address the need for mental health and behavioral health facilities. Now that so there's a lot of things going on there. There's the reimbursement side of it. There's the societal need. And there's the providers that are recognizing that there's an opportunity not only to service a line that historically hasn't been serviced, but also it has a trickle-through effect because a lot of those patients show up in the traditional acute care hospital in the emergency department. whether through an episodic event or some other means. And so this is a way to sort of take care of those patients and improve their bottom line on the acute care side. So a lot of these facilities we're seeing are in partnership or in conjunction with larger healthcare facilities.
Yeah. So the totality of all of this, is it equaling more people or more providers exploring behavioral health facilities, brand new ones, expansions?
Yes, there have traditionally been some systems that have focused on behavioral health, but you're seeing more systems now embrace a behavioral health arm, call it, of their service line. And then there are independent operators that are trying to break into the market as well. Some of the challenges we see is some of the independent operators have a more difficult time because they don't have a established process for referrals. So getting patients to come to the facility, some of the challenges with a behavioral health facility is you're either going there on your own or you're brought there by a loved one, and they're longer stay environments. So you can be there from a few days, a few weeks to a few months. Whereas, a typical acute care hospital, you go because you had something happen. You broke a bone, or you have a surgery that needs to happen, or the happy event is you're having the birth of a child. But those are what we call episodic events. So something happens and you have to go somewhere. A behavioral health facility is a facility that you go to for treatment, recovery, and then ultimately to return to normal daily life.
Let's talk about that, what a behavioral health facility is. I know for me, when I first started thinking about behavioral health, a certain kind of patient maybe comes to mind. And I would imagine that for others, a different sort of patient profile comes to mind.
Right.
Can you tell me about what a behavioral health facility is, fundamentally speaking, the kinds of patients they see? It's a range, I would imagine.
It is a range. So, behavioral health facility, it has everything to do, or typically relates to your mental health. So whether it's something every day, such as anxiety or depression or loneliness or feelings of hopelessness leading towards, hopefully not, but thoughts of suicide, things like that. And then you also have things like alcohol and drug addiction. You have Alzheimer's and dementia care. So there's a wide range of what it means to be a behavioral health facility. And they typically also cover everything from young pediatric patients all the way to geriatric or elderly patients. So you have both a broad spectrum of conditions and a broad spectrum of age ranges. And so typically what happens is a typical behavioral health facility will have what they classify as patient populations. And those are defined by specific areas within the facility. So in other words, like a pediatric patient will not intermingle with an adult patient or a geriatric patient. So they're distinct populations.
Yeah. Clearly different kinds of, right? You have operations, surgery, like you said, your bone's broken, you got to fix it at an acute facility. How do those differing services play out in terms of design? What does a behavioral health facility need that maybe we wouldn't think?
So one of the biggest differences, a good comparison for a behavioral health facility versus a traditional acute care hospital. When you're in an acute care hospital, you get your treatment and you basically stay in your patient room. You can watch TV in there, you can sleep in there, you have meals brought in there. In a behavioral health facility, you're consciously working to get that patient out of the patient room and back into a functioning role. And so in a behavioral health facility, the patient rooms are almost always, or at least 90%, semi-private. So you're in the room with another person, and that's partly to help, with trying to build your self-esteem, build relationship with another person. But then you're only in there when you're sleeping. So during the day, you're actually out of your patient room and you're in the activity areas. The other difference is, for example, like in an acute care, you might order room service in your room for meals. In a behavioral health setting, you are encouraged to go eat as a group. So your patient population, the group that you're living with, is the group that you will do activities with. It's the group that you'll go have meals with. And you're always encouraged to interact in that group.
So we've talked a little bit about the differences between behavioral health facilities and acute care facilities in terms of the functions that they have inside. You also touched a little bit on the sort of ways that it interacts with externally with the community, right? Acute facilities, you don't really need to do a lot of convincing to get someone to come in and take care of a broken bone.
Right.
But behavioral health facilities probably engage with the community or their patients or potential patients differently. What does that look like for them?
So you bring up a good point, because behavioral health facilities are, again, you either choose to go there or you're encouraged to go there. And so as opposed to an acute care hospital where you're going there for a specific service and a specific care, there's a lot of uncertainty with approaching a behavioral health facility. And so what we try to focus on and what we try to push is making it as warm and inviting and welcoming to that community as possible. They're also, very much, as you described, community-based. So it's not like you would go from where you live now to another state, potentially, to go to a behavioral health facility, unless it's, some extreme condition. And so they're very grounded in the community that they serve. And so we have really pushed to further that grounding by doing the research for the communities that they're planned to go in, looking at what makes those areas unique, things that they celebrate in that community, and then bringing those into the environment and again, making the environment warm and inviting. Much more, it's not a direct analogy, but we refer to it as trying to make it more resort-like and the place that you want to go, as opposed to an institutional type facility that is very off-putting and intimidating.
Right, because like we talked about, if mental health is becoming more and more of a topic of our lives and part of the national zeitgeist, right, it becomes then a part of the rhythm of our lives, hopefully, that we're taking care of our mental health.
Yeah, and these facilities, I would say they're predominantly inpatient, but the goal is to transition that patient from an inpatient to an outpatient. And so most of the facilities that we're looking at currently have, an inpatient component, but then they also have an outpatient component, so that as that patient progresses in their treatment and is discharged back to the home environment, then they come back on an every other week or once a month, and there's a group therapy setting that's part of the outpatient component that's on the front door, so to speak, of the facility.
Yeah. And, whether it's for outpatient treatment or if it's for maybe people who don't realize that they yet need help, I think that this idea of creating a place that you feel comfortable, welcome, is important, and probably also undoing some of the stigmas as well, right?
That's part of the goal. And so, we really focus on trying to break down, because these facilities can get to be a little overwhelming, because they tend to be single-story facilities because of that moving of the population around as a group. And with that, they become sort of large, spread out facilities, which can be a little bit intimidating. But so we try to break it down into the sort of three basic programmatic functions: the area that they sleep, the area that they have activities, or we call it the heart or the living room of the facility, and then areas that they gather, like with the communal dining. There's outdoor courtyard areas where they can go and have activities and things like that. And so those three components then each sort of have a different architectural flair or response specific to those. And that sort of helps reinforce that familiarity, comfort, warmth, resort style, kind of approach, hospitality, kind of approach. And it's a balancing it. It's a fine line, right? Because At the same time, you want to make sure that the staff is secure and protected, because obviously these patients are here, with potential conditions that, whether they intend to or not, can create safety issues. But there's a balance between, like, if I'm sitting here with you and we have a full height plexiglass window between us, you're not going to feel as comfortable having a conversation with me as we are sitting here, separated just by a table.
Right.
And so a lot of the things we design, like the nurse stations and things like that, have subtle security things built into them, but we're really trying to break down that stigma and not put up a barrier just to have a face-to-face conversation.
Right, and even if you're a different patient kind or type, maybe you have a different level of severity in your case, it maybe would be more off-putting to walk into a place that was divided by plexiglass.
And you try to design things, with that in mind, but also trying to design things that aren't trigger mechanisms. Certain colors, patterns, textures, shadows, light, dark, edges. There's a lot of things that go into the consideration to make sure that they're in as comfortable and safe environment as they can be in.
Tell me a little bit about those mechanisms and best practices.
Similar to, a lot of people, especially related to geriatric populations, have a difficulty with depth perception. So avoiding high contrast colors, avoiding things that look like a step that aren't a step. Floor pattern, colors, materials, those things become important. And then even we touched on these being community based. Well, we're doing a couple right now, one in Fort Worth and one in Austin, that have very strong community art components to them. And being careful and mindful in those selections of art that don't invoke triggers, don't invoke an emotional response, are abstract enough that people can see in them what they want, but not contrasting to the point that they cause a reaction.
Sure. I also understand that wandering and encouraging people to wander, but providing some sort of framework to do that in.
Yes, and so the challenge, of course, again, is they tend to try to keep the populations together as a group, but as individuals, we always need a moment to go and have personal respite, or a moment away. And so all of the activity areas we talk about are geared around group therapy kind of discussions or group activities, but there's always a component where somebody needs to get away, and I'm not talking about seclusion. So there are areas for seclusion if someone is really acting out and needs monitored time alone. But just for a moment to sit away from the group, still be part of the group, but sort of collect yourself. There's those kinds of things, as well as walking activities and things in the courtyard and the outdoor play areas.
Can you help me understand the unique challenges and needs of the patients and the staff of behavioral health facilities? What are they looking for when they come into a space?
They're looking for a safe place, number one, and a place that they can feel comfortable and that they're being taken care of. And that I'd say that's true for both the patient and the staff population, because one of the biggest challenges across healthcare in general is staff retention, staff burnout, and there's other similar high stress service lines, but behavioral health is definitely one where the staff are they're trying to help the patients, but they're also on guard, most of the day.
You're almost always on.
You're almost always aware of what's going around and making sure that, somebody's not trying to hurt themselves or hurt someone else.
And then the empathetic load too, right? So how do you support staff in these facilities?
So we focus a lot on, again, the warm, inviting environments, but also having access to natural daylight. Most of the facilities, like the patient population I described, they're 24-bed units, which is based on a certain nursing to patient ratio, so that there is always at least 3 nursing staff on a unit, so that if one staff member needs to get away and take a 15-minute respite, there's still 2 others that are covering the unit. and then having their own space to get away. So there's administrative offices, there are staff break areas, there's other outdoor areas that are geared towards the staff, and so it's really sort of trying to almost address any kind of situation or scenario that may come up, which makes it quite a challenge.
We've talked a lot about creating spaces that are welcoming and comfortable and really human when you get down to it, right? Anything that you've seen in your projects that you're working on that stand out to you as good examples or new ways of doing that?
I think the way we've approached the two that we're doing right now and sort of breaking those down into humanistic, human-centered sizes and around the functions that they are is somewhat unique to behavioral health. I don't think it's an approach. It's not an approach that I've seen publicized a lot. So, I kind of feel like we've hit on something that is a balance between what the hospital system needs out of the facility, as well as what the patient population wants and desires out of the facility.
And that's that scale model, right? Like you were saying, three more approachable
sort of
scales.
three approachable different functions. So the sleep area has a certain architectural response. The activity area has a certain architectural response, and then the gathering area has yet another architectural response.
What are some of those thematic architectural responses you might see in those areas? How do they differ from each other?
So the sleep area takes on a little bit more of what we'll, for lack of a better term, a residential feel. So it has, more of a residential scale to it. It has a more traditional roof line to it from the exterior. So there's also always this sort of interior-exterior reinforcement that you're in this area. This is the kind of behavior that is expected for that area. The activity area is more of like your local gym or your living room at home. It has that kind of appointment to it. It has more of a flat roof kind of exterior expression. Then the gathering space is really sort of more, I would say that's the most, quote unquote resort response to it. It still has a gabled roof to it, but it's not a traditional just one pitch roof. And I mean, we're kind of getting into architectural specifics now, but they have a scale and a function to them that responds to the emotion that is expected out of both the staff and the patient. So there's the built environment trying to reinforce the psychological environment.
So Shane, how do you expect our approach and the way that we think about these facilities to evolve over the coming years?
I think one of our challenges is we mentioned the two that we're doing currently. We're doing both of them simultaneously as a type of prototype, or the intent is to have them as a prototype that can be placed for this particular system anywhere in the country. And so, part of the reason they came to Corgan was as a way to bring in new ideas, look at things a little bit differently, because this is, as we discussed, is a growing service line. And so they're looking at ways to streamline this process so that they can have the most efficient and community-based facility anywhere that they want to go. And so we looked at how the structural system comes together, how the exterior materials come together, and whether they make sense here in Texas or in the Northeast or in the Northwest or in the Southeast. I mean, they're all completely different environments. So having something that you can somewhat site adapt for different locations is a big challenge. But for them, it's important because they're looking to take this on a grand scale across the country. So these are potentially two of many that are planned. And so that just speaks to the growing service line and the growing need for this facility.
Anything clients can learn from this process, other folks in the space?
I think at the end of the day, it comes down to being open, considering new ideas, being creative, not being afraid to lean into the fact that these are humans treating other humans. Most of healthcare is that way, but behavioral health is a little higher focus on that sort of human connection, human-centered design.
Sure. Well, thank you so much, Shane. And thank you for watching, and we'll see you on the next episode of The Square.